and I'm very proud to be here and to have the opportunity to explain and to talk about the company. So, well, I'm gonna talk about the role of technology in transforming health and care. I'm Raúl Gómez. I work as a telehealth project manager in Spain. So I'm working in Tunstall since 10 years ago. So I have in the room some old friends. So really happy to be here. Well, the question of Carlos. So let me talk about the company. For those of you who don't know Tunstall, Tunstall is a company founded more than 60 years ago. So we are not a startup. So we have 3,000 employees, and we have presence in 18 countries. So we are a technology-based company that is focused on the developing and manufacture of technology solutions to deliver efficient and effective person-centered care. So this is some information about Tunstall Global. Now speaking in Spain, so we have like different roles in Spain. So a part of being a manufacturer and sell technology, we are also a service provider. So here in Spain, 40% of the telecare users, so we provide the service to them. So we have 6 response centers in different regions. As for example, here in Madrid City Council, where we provide the telecare service in a lot of the tender. But we also provide the service in Castilla-La Mancha, in Murcia, so we have some regions. And apart from that, we provide the technologies to some other service providers. So, as in the slide, 70% of the technology used in the telecare service is Tunstall technology. So in our business, so we have 3 different lines of business. As I said, the telecare service, so we are a service provider with different levels of service according to the project or the clients. We also, as I mentioned, we are technology manufacturers. So we manufacture the telecare units, sensors to install in the users' homes. And we also have the third line of business, which is the one that I work in, is the digital health solutions. Really happy to hear some colleagues before that mentioned about the CE mark and the national security schema. So this is something that we are proud to have in our solution and service. So let me talk about the evolution of both service and technology from some years ago. So from our point of view, we've been seeing an evolution from a reactive technology and service, what basically was focused on monitoring 24 hours a day a person to try to help that person in an event of an urgency or a risk situation. That service and technology evolved to a proactive service, basically to support a tailored service according to the user's needs. And also contacting and being in contact with the users more and more proactive than in the past. The practice service evolved to a predictive service, what basically was focused to prevent and avoid adverse events from gathering information from the past service. And we are currently in an evolution, what we call a cognitive care, what basically is to gather information from different sources of information, mix everything, and analyze it to act in a predictive, proactive, and reactive way. So this is the evolution. Everybody knows that around the world the care system is facing unsustainable levels of demand and complexity. However, we think that technology can help us to live the way we want and to prevent illness and save lives. So for today, I bring with me two projects that we are currently doing in Spain from our point of view, some good examples. So the first one is a project called Conéctate en Río Lobos. So Río Lobos, for those of you who probably don't know, I know neither some years ago, Río Lobos is a remote municipality in Extremadura. It's a really small municipality with just 1,500 residents. That has developed a really interesting project because they are mixing all the service that they have in the municipality to try to avoid the population within the village. So the mayor of the town, the vision of the mayor of the town was to convert the streets of the village into the corridors of a nursing home. So they have built a set of services around the nursing home to provide different and services to the users to try to get them into the house to continue living the life in the way they want. So within this project, we are providing like the technology in two different aspects. First of all is the telehealth. So we are providing our technology for remote patient monitoring. And from the nursing home, they are not only doing monitoring of the health situation of the users, of the patients within the nursing home, but also to the residents in the village. So they are following the health situation. They are monitoring the vital signs, and through interviews, asking some questions. The people in the nursing home is analyzing the information and acting according to the needs of the users. Apart from that, we are providing some well-being recommendations and information. So, yeah, to try to also interact between the residents. So, it's to try to avoid like the isolation within the village. And the other aspect that we are working in the project is the risk detection. And in this field, we are working with the village providing technology for the risk detection within the nursing home and within the user's home and outside, out of the user's home. So within the nursing home, we are providing technology for wander control, for fall detection, and bed and chair occupancy. So to try to help the people in the nursing home to act according to the possible risks. And more or less it's the same within the user homes, and we are providing technology for risk detection outside of the user's home. And the last project that I want to talk about is a remote patient monitoring project that we are currently doing in the Basque Country, in Osakidecha. So we are the service provider of the chronic disease monitoring project. So within this project, there are a set of patients. We're currently more than 400 with COPD and heart failure that use our technology to provide information to the GPs. We have presence in 5 hospitals, basically they are using our technology to day by day providing the information about their health situation. Some important aspect in this project is that we've developed the integration from our system to the electronic health record of Osakidecha. So all the information gathered within the user's home, it's automatically stored in the electronic health record of the patients. And the satisfaction of the patients it's really high. So and basically that's all. I try to fit into the time because